Question 1. Regulatory review indicates that a young adult with ASD, who has historically relied on structured routines, is expressing a strong desire to move into an independent living situation immediately after high school graduation. While the individual is articulate about their desire for independence, they have not yet explored practical aspects like budgeting, meal preparation, or navigating public transportation. Their parents are concerned about their preparedness and the potential for isolation. What is the most ethically and professionally sound approach for the certified autism specialist to take in supporting this transition? Option A. Advise the individual and their parents that immediate independent living is not advisable given the identified skill gaps, and recommend a period of supported living arrangements until more skills are acquired. Option B. Focus solely on the individual's expressed desire for independence and proceed with connecting them to independent living resources without further discussion of potential challenges or parental concerns. Option C. Encourage the individual to delay their move to independent living for at least 1 year to allow for extensive skill-building workshops and to ensure parental comfort with the timeline. Option D. Facilitate a collaborative planning process involving the individual, their parents, and relevant community support services to develop a phased transition plan that addresses practical skills, identifies potential challenges, and builds a support network, while respecting the individual's ultimate decision-making authority. Correct answer is D. Facilitate a collaborative planning process involving the individual, their parents, and relevant community support services to develop a phased transition plan that addresses practical skills, identifies potential challenges, and builds a support network, while respecting the individual's ultimate decision-making authority. Explanation. This scenario presents a common ethical challenge in supporting individuals with autism spectrum disorder, ASD, through significant life transitions. The core difficulty lies in balancing the individual's autonomy and expressed preferences with the potential need for structured support and advocacy, especially when communication barriers or executive functioning challenges may be present. Professionals must navigate the complexities of informed consent, the right to self-determination, and the duty to ensure the individual's well-being and access to necessary services, all within the established ethical guidelines and regulatory frameworks governing their practice. The correct approach prioritizes a person-centered, collaborative process that respects the individual's agency while ensuring comprehensive support. This involves actively seeking and incorporating the individual's preferences, involving their support network, with consent, and proactively identifying and addressing potential barriers to successful transition. This aligns with ethical principles of respect for autonomy, beneficence, and non-maleficence, as well as regulatory requirements that mandate individualized support plans and the promotion of self-advocacy. An incorrect approach that solely relies on the individual's immediate verbalizations without further exploration or support planning fails to adequately address potential underlying challenges or long-term needs. This could lead to a transition that is not truly sustainable or beneficial, potentially violating the duty of care and the principle of beneficence. Another incorrect approach that overrides the individual's stated preferences without thorough investigation and justification risks violating their right to self-determination and autonomy, potentially leading to resentment and disempowerment. A third incorrect approach that focuses exclusively on administrative tasks without engaging the individual or their support system neglects the human element of transition and the importance of personalized support, potentially leading to a disjointed and ineffective transition process. Professionals should employ a decision-making framework that begins with active listening and empathetic understanding of the individual's perspective. This should be followed by a thorough assessment of their needs, strengths, and preferences, considering their communication style and any potential challenges. Collaboration with the individual, their family or chosen support persons, with consent, and relevant service providers is crucial. Proactive problem-solving and the development of a flexible, individualized transition plan that includes contingency measures are essential for ensuring a positive and sustainable outcome. Question 2. Market research demonstrates that a significant portion of individuals with autism spectrum disorder benefit from augmentative and alternative communication (ACC) systems. A new client, a 7-year-old nonverbal child with autism, has been referred for communication intervention. The parents are eager for their child to communicate effectively and have expressed interest in the latest, most advanced speech-generating devices they saw advertised. However, the child has significant sensory sensitivities and a history of difficulty with fine motor control. Based on best practices for communication intervention, what is the most appropriate initial step? Option A. Implement a picture exchange communication system, PECS, as it is a widely recognized and evidence-based intervention for nonverbal children with autism, without further assessment. Option B. Immediately recommend a state-of-the-art speech-generating device, as market research indicates these are highly effective, and the parents have expressed a preference for advanced technology. Option C. Advise the parents that due to the child's sensory sensitivities and fine motor challenges, high-tech AAC devices may not be suitable at this time, and suggest focusing on nonverbal communication strategies like gestures and facial expressions. Option D. Conduct a comprehensive, individualized assessment of the child's communication strengths, needs, sensory profile, and motor abilities, and collaboratively explore various AAC options, including picture exchange systems and low-tech devices, with the family before recommending a specific high-tech device. Correct answer is D. Conduct a comprehensive, individualized assessment of the child's communication strengths, needs, sensory profile, and motor abilities, and collaboratively explore various AAC options, including picture exchange systems and low-tech devices, with the family before recommending a specific high-tech device. Explanation. This scenario presents a common implementation challenge when introducing communication interventions for individuals with autism. The professional challenge lies in balancing the desire for rapid progress with the ethical and practical considerations of individual needs, family involvement, and the evidence-based nature of interventions. Careful judgment is required to ensure that the chosen intervention is not only effective, but also sustainable and culturally sensitive. The correct approach represents best professional practice because it prioritizes a thorough, individualized assessment and a collaborative decision-making process. This aligns with ethical guidelines that mandate person-centered planning and informed consent. Specifically, it respects the individual's unique communication profile, learning style, and sensory needs, which are paramount in selecting an appropriate augmentative and alternative communication (AUX) system. Furthermore, involving the family or primary caregivers is crucial for generalization of skills and ensuring the long-term success of the intervention. This collaborative approach also adheres to principles of evidence-based practice by ensuring the chosen intervention has demonstrated efficacy for similar profiles, while acknowledging the need for adaptation. An incorrect approach that focuses solely on the most technologically advanced or widely publicized AAC system without a comprehensive assessment fails to meet the individual's specific needs. This could lead to frustration, disengagement, and ultimately, the failure of the intervention. Ethically, this approach neglects the principle of do no harm by potentially imposing an unsuitable or overwhelming system. It also bypasses the crucial step of informed consent by not fully exploring alternatives and their suitability. Another incorrect approach that prioritizes a single, rigid implementation of a communication system, such as PECS, without considering the individual's progress or potential need for alternative or supplementary strategies, is also professionally unsound. This rigidity can stifle progress and fail to adapt to evolving needs. Ethically, this demonstrates a lack of ongoing assessment and a failure to adjust interventions based on the individual's response, which is a core tenet of effective practice. A further incorrect approach that relies on anecdotal evidence or the preferences of other professionals without direct assessment of the individual and their environment is problematic. While peer consultation is valuable, it cannot replace individualized assessment. This approach risks implementing an intervention that is not evidence-based for the specific individual or context, potentially leading to wasted resources and unmet needs. It also fails to uphold the ethical responsibility to provide services based on sound professional judgment and evidence. The professional decision-making process for similar situations should involve a systematic approach. 1. Comprehensive assessment. Conduct a thorough evaluation of the individual's communication strengths, challenges, sensory profile, cognitive abilities, and environmental factors. 2. Collaborative goal setting. Engage the individual to the extent possible and their support network in identifying meaningful communication goals. 3. Evidence-based intervention selection. Research and consider interventions with demonstrated efficacy for similar profiles, prioritizing those that align with the assessment findings and goals. 4. Individualized adaptation. Recognize that no intervention is one-size-fits-all and be prepared to adapt the chosen system and its implementation to the individual's unique needs. 5. Ongoing monitoring and evaluation. Continuously assess the effectiveness of the intervention and make adjustments as needed. 6. Ethical considerations. Ensure informed consent, respect for autonomy, and a commitment to the individual's well-being throughout the process. Question 3. Market research demonstrates that a significant portion of individuals seeking support services exhibit a range of social communication challenges and restricted, repetitive behaviors. A parent brings their child to a CAS, expressing concerns that the child displays many of these characteristics, but they have not pursued a formal diagnosis due to cost and accessibility issues. The parent is asking for advice on specific strategies to help their child manage these challenges, implying they believe the child has autism. As a CAS, what is the most appropriate course of action? Option A. Recommend that the parent pursue a formal diagnostic evaluation for their child with a qualified professional, explaining the benefits of a diagnosis for accessing appropriate services and interventions, while offering general information about ASD and support resources. Option B. Suggest that the parent focus on general behavioral strategies that are applicable to a wide range of developmental challenges, and avoid discussing autism specifically, as a formal diagnosis has not been established. Option C. Begin implementing evidence-based interventions commonly used for autism, assuming the child's presentation aligns with ASD, and inform the parent that these strategies are likely to be beneficial regardless of a formal diagnosis. Option D. Advise the parent that based on their description, the child's behaviors are highly indicative of autism, and suggest specific autism-focused interventions that the parent can implement at home without requiring a formal diagnosis. The correct answer is A. Recommend that the parent pursue a formal diagnostic evaluation for their child with a qualified professional, explaining the benefits of a diagnosis for accessing appropriate services and interventions, while offering general information about ASD and support resources. Explanation. This scenario presents a common challenge for certified autism specialists, CAS, when encountering individuals who may exhibit characteristics of autism spectrum disorder (ASD), but have not received a formal diagnosis. The professional challenge lies in balancing the need for evidence-based interventions with the ethical imperative to avoid making diagnostic pronouncement without proper training and authority, and to respect the individual's right to a formal diagnostic process. Careful judgment is required to determine the appropriate course of action that supports the individual's well-being and aligns with professional scope of practice. The correct approach represents best professional practice because it prioritizes the individual's access to a comprehensive and accurate diagnosis by qualified professionals. This aligns with ethical guidelines that emphasize acting within one's scope of practice and avoiding the unauthorized practice of medicine or psychology. By recommending a formal evaluation, the CAS is facilitating the individual's journey towards receiving appropriate support and services based on a confirmed diagnosis, which is crucial for effective intervention planning. This approach upholds the principle of beneficence by ensuring the individual receives the most accurate and beneficial care. An incorrect approach that involves directly applying ASD-specific interventions without a formal diagnosis is professionally unacceptable. This constitutes practicing outside the scope of a CAS certification, which typically does not grant diagnostic authority. Such an action could lead to misdiagnosis, inappropriate or ineffective interventions, and potentially harm to the individual by delaying or misdirecting necessary support. It also violates the ethical principle of non-maleficence by potentially causing harm through unqualified practice. Another incorrect approach, such as dismissing the observed behaviors as unrelated to ASD without further exploration, is also professionally problematic. While a CAS should not diagnose, they also have a responsibility to recognize potential indicators and guide individuals toward appropriate resources. Ignoring potential signs without suggesting further evaluation could be seen as a failure to act in the individual's best interest and a missed opportunity to facilitate access to needed support. This could be viewed as a lapse in professional diligence. A further incorrect approach, such as providing a preliminary opinion on the likelihood of ASD to the individual or their family, crosses the boundary of a CAS's role. While providing information about ASD is within scope, offering a personal assessment of diagnostic likelihood without being a licensed diagnostician is inappropriate and can create undue expectations or anxiety. This can lead to misinterpretations and potentially influence decisions about seeking formal evaluation in a way that is not evidence-based. The professional decision-making process for similar situations should involve a clear understanding of the CAS scope of practice, which focuses on support, intervention strategies, and advocacy for individuals with diagnosed ASD, rather than diagnosis itself. When presented with individuals exhibiting potential ASD characteristics without a diagnosis, the professional should 1. Acknowledge and validate the observed concerns. 2. Educate the individual or family about ASD and the diagnostic process. 3. Strongly recommend seeking a formal diagnostic evaluation from a qualified professional, e.g., psychologist, psychiatrist, developmental pediatrician. 4. Offer support in navigating the process of seeking evaluation and accessing resources once a diagnosis is confirmed. This systematic approach ensures ethical practice, respects professional boundaries, and prioritizes the individual's access to accurate diagnosis and appropriate care. Question 4. Implementation of a comprehensive assessment for a young child suspected of having autism spectrum disorder requires gathering information from key individuals in the child's life. A certified autism specialist is tasked with selecting and utilizing parent and teacher questionnaires to inform the assessment process. Which of the following approaches best aligns with ethical and professional standards for this task? Option A. Select a single, widely recognized questionnaire and distribute it to parents and teachers with minimal explanation, assuming they understand its purpose and how to complete it accurately. Option B. Prioritize questionnaires that are quick and easy to complete, even if they are not specifically designed for autism assessment or have limited research supporting their validity. Option C. Utilize a variety of evidence-based questionnaires appropriate for the child's age and developmental stage, providing clear instructions and context to parents and teachers regarding the purpose of each questionnaire and how the information will be used to support the child. Option D. Rely exclusively on questionnaire data to form the primary basis of the assessment, without seeking additional information through observation or interviews. The correct answer is A. Select a single, widely recognized questionnaire and distribute it to parents and teachers with minimal explanation, assuming they understand its purpose and how to complete it accurately. Explanation. This scenario presents a common challenge in autism support, ensuring that the tools used to gather information are both effective and ethically administered, particularly when relying on parent and teacher questionnaires. Professional challenge lies in balancing the need for comprehensive data with the potential for bias, misinterpretation, or the creation of undue stress for informants. Careful judgment is required to select and implement questionnaires in a way that maximizes their utility while minimizing harm and upholding professional standards. The correct approach represents best professional practice because it prioritizes a multifaceted, collaborative, and informed process. This involves selecting questionnaires that are evidence-based and appropriate for the age and developmental level of the individual. Crucially, it includes providing clear, accessible instructions and context to parents and teachers, explaining the purpose of the questionnaires and how the information will be used. This fosters transparency and trust, increasing the likelihood of accurate and useful responses. Furthermore, it emphasizes the importance of integrating questionnaire data with other sources of information, such as direct observation and interviews, to form a holistic understanding. This aligns with ethical guidelines that mandate comprehensive assessment and avoid over-reliance on single data points, ensuring that decisions are well-informed and person-centered. An incorrect approach that involves administering a single, unvalidated questionnaire without explanation is professionally unacceptable. This fails to meet the ethical obligation to use appropriate assessment tools and can lead to inaccurate or misleading information. It also violates the principle of informed consent and collaboration by not adequately informing parents and teachers about the process, potentially causing confusion or anxiety. Another incorrect approach, which is to solely rely on questionnaire data without any supplementary information, is also professionally unsound. This creates a significant risk of misdiagnosis or incomplete understanding of the individual's needs. Ethical practice demands a comprehensive assessment that triangulates information from multiple sources, Relying exclusively on questionnaires can lead to a narrow and potentially biased perspective, failing to capture the full spectrum of an individual's strengths and challenges. A further incorrect approach, such as using questionnaires designed for a different age group or cultural context without adaptation, is ethically problematic. This demonstrates a lack of professional due diligence and can result in irrelevant or misinterpreted data. Best practice requires careful consideration of the suitability of assessment tools for the specific individual and their environment, ensuring that the tools are culturally sensitive and developmentally appropriate. The professional decision-making process for similar situations should involve a systematic evaluation of assessment needs. This includes identifying the specific information required, researching and selecting evidence-based and appropriate assessment tools, and planning for their administration in a way that is collaborative and informative for all stakeholders. Professionals must be prepared to integrate data from various sources, critically evaluate the quality and limitations of each piece of information, and use this comprehensive understanding to inform interventions and support plans, always prioritizing the well-being and best interests of the individual. Question 5. The control framework reveals that a certified autism specialist, CAS, is tasked with developing strategies to enhance social interactions for a client with autism spectrum disorder. Considering the client's history of social anxiety and preference for structured environments, which approach would best align with ethical practice and promote meaningful social engagement? Option A. Increase the frequency of the client's participation in large, unstructured social gatherings to encourage spontaneous social learning. Option B. Provide the client with a comprehensive list of social rules and expected behaviors to memorize and apply in all social situations. Option C. Place the client in challenging social scenarios with minimal support, expecting them to adapt through direct exposure. Option D. Implement a gradual, individualized plan that incorporates direct instruction in social skills, peer-mediated interventions within familiar settings, and opportunities for the client to co-create social goals. The correct answer is D. Implement a gradual, individualized plan that incorporates direct instruction in social skills, peer-mediated interventions within familiar settings, and opportunities for the client to co-create social goals. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the certified autism specialist, CAS, to balance the individual needs of a client with autism spectrum disorder (ASD, with the broader goal of fostering social inclusion within a community setting. The CAS must select strategies that are evidence-based, ethically sound, and respectful of the client's autonomy and preferences, while also considering the practicalities of implementation and potential impact on others. The inherent variability in how individuals with ASD experience social interactions necessitates a nuanced and individualized approach, making a one-size-fits-all solution inappropriate. Correct approach analysis. The correct approach emphasizes a collaborative and individualized strategy that directly addresses the client's specific social deficits and strengths. By involving the client in goal setting and utilizing evidence-based interventions like social skills training and peer-mediated strategies, the CAS is adhering to best professional practices. This approach is ethically justified by principles of client-centered care, promoting autonomy and self-determination. It aligns with the ethical guidelines for CAS professionals, which mandate the use of evidence-based practices and the tailoring of interventions to individual needs. Furthermore, it promotes a positive and empowering experience for the client, fostering genuine social connection rather than mere compliance. Incorrect approaches analysis. One incorrect approach focuses solely on increasing the frequency of social interactions without considering the quality or the client's readiness or comfort level. This could lead to overwhelming or aversive experiences for the individual with ASD, potentially exacerbating social anxiety and leading to avoidance. Ethically, this approach fails to prioritize the client's well-being and could be seen as a violation of the principle of do no harm. It also neglects the importance of individualized assessment and intervention planning. Another incorrect approach relies on generalized social scripts or rote memorization of social rules without fostering genuine understanding or flexibility. While some structured learning can be beneficial, an over-reliance on this can lead to superficial social interactions that lack authenticity and may not generalize to novel situations. This approach fails to develop the underlying social cognition and emotional regulation skills necessary for successful social engagement. Ethically, it can lead to a situation where the individual appears to be socially competent, but lacks the internal capacity for genuine connection, potentially leading to misunderstandings and social isolation in the long run. A further incorrect approach involves placing the individual in highly demanding social situations without adequate preparation or support, expecting them to learn by immersion. This approach disregards the potential for sensory overload, anxiety, and negative social experiences that can be detrimental to an individual with ASD. It is ethically problematic as it prioritizes a desired outcome over the immediate needs and safety of the client, potentially causing distress and reinforcing negative associations with social engagement. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a comprehensive assessment of the individual's strengths, challenges, preferences, and goals related to social interaction. This assessment should inform the development of a personalized intervention plan that incorporates evidence-based strategies. Collaboration with the individual, their family, and other relevant stakeholders is crucial. Professionals must continuously monitor progress, adapt interventions as needed, and prioritize the client's well-being, autonomy, and dignity throughout the process. Ethical considerations, including informed consent and the avoidance of harm, must guide every decision. Question 6. Operational review demonstrates that a 7-year-old child presents with significant challenges in social reciprocity, including difficulty initiating and maintaining conversations, and a lack of typical peer engagement. The child also exhibits restricted interests, spending hours engrossed in a specific topic to the exclusion of other activities, and displays repetitive motor movements, such as hand flapping, particularly when excited. However, the child also demonstrates significant inattention, impulsivity, and hyperactivity, which interfere with classroom learning and daily routines. The assessment team is considering a differential diagnosis. Which of the following approaches best aligns with current diagnostic standards and ethical best practices for this scenario? Option A. Assume the presence of autism spectrum disorder and recommend interventions targeting social skills and repetitive behaviors, as the observed social deficits are highly indicative of ASD. Option B. Prioritize the diagnosis of attention deficit/hyperactivity disorder due to the prominent inattention and hyperactivity, and consider ASD as a secondary consideration only if ADHD treatment is ineffective. Option C. Conduct a comprehensive diagnostic evaluation that considers autism spectrum disorder, attention deficit/hyperactivity disorder, and other potential co-occurring conditions, utilizing standardized assessments, clinical observation, and developmental history to differentiate symptoms and determine the most accurate diagnosis or diagnoses. Option D. Focus solely on the social communication deficits and restricted interests to diagnose autism spectrum disorder, as these are core diagnostic features. The correct answer is D. Focus solely on the social communication deficits and restricted interests to diagnose autism spectrum disorder, as these are core diagnostic features. Explanation. This scenario presents a common challenge in the field of autism specialization, differentiating between autism spectrum disorder (ASD) and other neurodevelopmental conditions that share overlapping symptoms. The professional's task is to move beyond superficial symptom matching and conduct a thorough, evidence-based assessment that considers the nuances of each potential diagnosis. The challenge lies in avoiding premature conclusions and ensuring that the assessment process is comprehensive, ethical, and aligned with best practices for differential diagnosis. The correct approach involves a multifaceted assessment that integrates information from various sources, including direct observation, parent/caregiver reports, and standardized diagnostic tools. This approach is best professional practice because it adheres to the diagnostic criteria outlined in the DSM-5, Diagnostic and Statistical Manual of Mental Disorders, 5th edition, which is the standard for diagnosing ASD and other mental health conditions. It prioritizes a holistic understanding of the individual, considering their developmental history, social communication patterns, restricted interests, and repetitive behaviors in context. Furthermore, it acknowledges the possibility of co-occurring conditions and the need to rule out alternative explanations for the observed behaviors. This systematic and comprehensive methodology ensures that the diagnosis is accurate, leading to the most appropriate and effective intervention plan. An incorrect approach would be to rely solely on a single symptom or a limited set of observations to make a diagnosis. For instance, focusing only on a child's difficulty with social interaction without exploring the underlying reasons or considering other diagnostic possibilities would be a significant ethical and professional failure. This could lead to misdiagnosis, resulting in the individual not receiving the appropriate support and interventions for their actual needs. Another failure would be to dismiss the possibility of co-occurring conditions, such as ADHD or sensory processing disorder, and attribute all behaviors solely to ASD. This oversight can lead to incomplete treatment plans that do not address all of the individual's challenges. Ethically, professionals are obligated to conduct thorough assessments and avoid diagnostic shortcuts that could harm the individual. Regulatory frameworks, such as those governing the practice of specialists, mandate adherence to diagnostic standards and ethical conduct, which includes conducting comprehensive evaluations. A professional decision-making process for similar situations should involve a commitment to ongoing learning and adherence to diagnostic guidelines. Professionals should always begin with a broad differential diagnosis, considering all plausible conditions that could explain the presenting concerns. They should then systematically gather information through a variety of assessment methods, triangulating data from different sources. Crucially, they must be prepared to revise their hypotheses as new information emerges. This iterative process, grounded in evidence and ethical principles, ensures that the individual's needs are accurately identified and addressed. Question 7. The evaluation methodology shows that a young adult with autism spectrum disorder, who has limited verbal communication, is struggling to express their needs and preferences in various social settings. Their family is seeking recommendations for technology to support their communication. Considering the individual's profile, which of the following approaches best aligns with best practices for selecting assistive communication technology? Option A. Suggesting a comprehensive assessment of the individual's communication strengths, challenges, sensory sensitivities, cognitive abilities, and environmental needs, followed by a collaborative selection of appropriate assistive technology, including a trial period and ongoing support. Option B. Recommending a high-end, feature-rich speech-generating device that has been shown to be effective for many individuals with similar communication challenges. Without further individual assessment. Option C. Advising the family to explore the latest trending communication apps on the market, as these are often the most innovative and effective solutions. Option D. Proposing the use of a basic picture exchange system, PEX, as a starting point, assuming it will be sufficient for all their communication needs. The correct answer is B. Recommending a high-end, feature-rich speech-generating device that has been shown to be effective for many individuals with similar communication challenges, without further individual assessment. Explanation. The evaluation methodology shows a need to assess the effectiveness of technology in supporting communication for individuals with autism. This scenario is professionally challenging because selecting and implementing assistive technology requires a nuanced understanding of the individual's specific communication profile, sensory needs, cognitive abilities, and environmental context. A one-size-fits-all approach is inappropriate and can lead to ineffective interventions, frustration for the individual, and wasted resources. Careful judgment is required to ensure the chosen technology is not only functional, but also promotes independence, social engagement, and overall well-being, aligning with best practices in autism support. The correct approach represents best professional practice by prioritizing a comprehensive, individualized assessment. This involves collaborating with the individual, their family, and other relevant professionals to understand their unique strengths, challenges, and preferences. It also necessitates a thorough review of available evidence-based assistive technology options, considering factors such as ease of use, customization potential, and integration with existing communication strategies. The goal is to select technology that empowers the individual to express themselves more effectively, understand others better, and participate more fully in their environment. This aligns with ethical principles of person-centered care and the professional responsibility to provide evidence-informed interventions. An incorrect approach that focuses solely on the most popular or technologically advanced app, without considering the individual's needs, represents a failure to adhere to person-centered principles. This can lead to a mismatch between the technology and the user, rendering it ineffective and potentially causing distress. Another incorrect approach that involves recommending a device without adequate training for the individual and their support network overlooks the crucial aspect of implementation. Technology is only effective when it is used competently and consistently. Failure to provide adequate training can result in underutilization or misuse of the technology, negating its potential benefits. A third incorrect approach that prioritizes cost-effectiveness over functional appropriateness ignores the primary ethical obligation to serve the best interests of the individual. While resource management is important, it should not compromise the quality or suitability of the intervention. Professionals should employ a decision-making framework that begins with a thorough needs assessment, followed by research into evidence-based technological solutions. This should include a trial period with potential technologies, ongoing evaluation of their effectiveness, and continuous adaptation based on the individual's progress and feedback. Collaboration with the individual and their support system is paramount throughout this process, ensuring that the chosen technology truly enhances their communication and overall quality of life. Question 8. Investigation of how a certified autism specialist, CAS, would best assess an individual's capacity to understand the perspectives of others, a key component of theory of mind, when the individual presents with significant communication challenges and a history of social anxiety in unfamiliar settings. The CAS has conducted a brief initial interview and observed the individual in a controlled clinic setting. Option A. Conclude that the individual's communication challenges and anxiety in the clinic setting definitively indicate a severe deficit in theory of mind, and therefore recommend only basic social skills training focused on rote imitation. Option B. Administer a standardized theory of mind assessment tool designed for verbally fluent individuals without considering the individual's communication profile or the impact of anxiety on test performance. Option C. Recommend a comprehensive assessment battery that includes direct observation in a more naturalistic setting, structured social scenarios, and input from familiar caregivers regarding the individual's typical social interactions and understanding of others' feelings. Option D. Rely solely on the initial brief interview and clinic observation, interpreting any hesitations or nonverbal cues as direct evidence of a complete lack of understanding of others' perspectives, and suggest minimal social interaction support. The correct answer is C. Recommend a comprehensive assessment battery that includes direct observation in a more naturalistic setting, structured social scenarios, and input from familiar caregivers regarding the individual's typical social interactions and understanding of others' feelings. Explanation. This scenario presents a professional challenge due to the nuanced nature of assessing social cognition and theory of mind in individuals with autism. It requires a deep understanding of how these skills manifest, the potential for variability, and the ethical imperative to avoid misinterpretation or overgeneralization. The professional must navigate the complexities of observing behavior, interpreting subtle cues, and applying assessment tools without imposing biases. The correct approach represents best professional practice because it prioritizes a multifaceted, individualized assessment that considers the individual's unique presentation of autism. This aligns with ethical guidelines that mandate person-centered care and the avoidance of diagnostic overshadowing. By integrating direct observation, caregiver input, and standardized measures, the professional gathers comprehensive data to form a well-supported conclusion. This approach respects the individual's autonomy and avoids making assumptions based on a single observation or a limited understanding of their social cognitive profile. It also implicitly adheres to principles of evidence-based practice by utilizing a range of validated assessment methods. An incorrect approach that relies solely on a single, brief interaction with the individual would be professionally unacceptable. This fails to account for situational factors, anxiety, or the individual's comfort level, all of which can significantly impact social performance. Such an approach risks misinterpreting a temporary difficulty as a pervasive deficit, leading to inaccurate conclusions and potentially inappropriate intervention plans. Ethically, it violates the principle of thoroughness and could result in harm by mischaracterizing the individual's capabilities. Another incorrect approach that focuses exclusively on a checklist of observable behaviors without considering the underlying cognitive processes would also be problematic. While observable behaviors are important, they are only one piece of the puzzle. Social cognition and theory of mind involve internal mental states and inferential reasoning. A purely behavioral approach might miss the subtle but significant differences in how an individual understands social situations, leading to an incomplete or inaccurate assessment. This could lead to interventions that do not address the core social cognitive challenges. A third incorrect approach that assumes all individuals with autism have identical deficits in social cognition and theory of mind is a significant ethical and professional failure. Autism is a spectrum, and the manifestation of social cognitive differences varies widely. Generalizing deficits without individual assessment is stereotyping and can lead to missed strengths and inappropriate support. This approach disregards the principle of individualization and can perpetuate harmful stereotypes. The professional decision-making process for similar situations should involve a systematic approach. 1. Define the specific area of concern, e.g., understanding emotions, inferring intentions. 2. Gather information from multiple sources, individual, caregivers, educators. 3. Select appropriate assessment tools and methods that are sensitive to individual differences and the specific skills being evaluated. 4. Conduct observations in naturalistic settings where possible, in addition to structured assessments. 5. Analyze the data holistically, considering the interplay of cognitive, behavioral, and environmental factors. 6. Formulate conclusions that are supported by the evidence and acknowledge any limitations of the assessment. 7. Develop intervention plans that are individualized and address identified needs while building on strengths. 8. Continuously monitor progress and adjust interventions as needed. Question 9. What factors determine the most effective strategies for building friendships and social networks for individuals with autism, considering their unique strengths and challenges? Option A. The extent to which an individual can suppress autistic mannerisms to conform to neurotypical social expectations. Option B. The individual's specific interests, preferred communication style, sensory sensitivity, and the availability of naturalistic social opportunities within their community. Option C. The sole reliance on teaching abstract social rules and theoretical concepts without practical application in real-world social settings. Option D. The implementation of standardized, group-based social skills, curricula regardless of individual preferences or environmental context. The correct answer is B. The individual's specific interests, preferred communication styles, sensory sensitivities, and the availability of naturalistic social opportunities within their community. Explanation. This scenario is professionally challenging because building friendships and social networks for individuals with autism requires a nuanced understanding of their unique communication styles, sensory sensitivities, and social processing differences. Professionals must navigate the ethical imperative to promote social inclusion and independence while respecting individual autonomy and avoiding prescriptive approaches that may not align with the individual's goals or preferences. Careful judgment is required to balance support with self-determination. The correct approach represents best professional practice because it is grounded in person-centered planning and evidence-based strategies that are responsive to the individual's specific needs and strengths. It emphasizes collaboration with the individual and their support network, fostering naturalistic social opportunities, and teaching generalized social skills in a supportive environment. This aligns with ethical guidelines that prioritize individual dignity, respect, and the promotion of meaningful social connections. Regulatory frameworks often mandate that services be individualized and outcome-oriented, focusing on enhancing quality of life and community participation. An incorrect approach that relies solely on structured, artificial social skills groups without considering the individual's interests or natural social environments fails to acknowledge the importance of generalization and may not lead to sustainable friendships. This could be seen as a failure to provide individualized services as mandated by many regulations, and ethically, it risks imposing a one-size-fits-all solution that does not respect the individual's unique social profile. Another incorrect approach that focuses exclusively on teaching abstract social rules without practical application in real-world settings overlooks the need for experiential learning and may not equip the individual with the skills to navigate dynamic social interactions. This could be a regulatory failure if it does not demonstrate progress towards functional social outcomes, and an ethical failure in not providing effective, relevant support. A third incorrect approach that prioritizes the reduction of autistic traits over the development of social connections misinterprets the goals of support. This is a significant ethical failure, as it can lead to internalized stigma and a focus on conformity rather than acceptance and inclusion. It also likely violates regulatory requirements that focus on enhancing an individual's quality of life and social integration. The professional decision-making process for similar situations should involve a thorough assessment of the individual's social strengths, challenges, interests, and goals. This should be followed by collaborative goal setting with the individual and their family or support system. Professionals should then select and implement evidence-based interventions that are tailored to the individual, focusing on fostering naturalistic social opportunities, teaching functional social skills, and promoting self-advocacy. Ongoing monitoring and evaluation of progress, with adjustments made as needed, are crucial to ensure the effectiveness and ethical delivery of support. Question 10. When evaluating social skills training programs for individuals with autism, what is the most ethically and professionally sound approach to ensure optimal outcomes? Option A. Implement a program that focuses exclusively on teaching discrete social behaviors in a structured setting, without considering how these skills will be applied in real-world situations. Option B. Prioritize a program that has strong empirical evidence supporting its efficacy for specific social skill deficits and is tailored to the individual's unique strengths, needs, and learning style, with a plan for generalization. Option C. Select a program based on its widespread popularity and availability, assuming it is effective for most individuals. Option D. Choose a program recommended by a colleague, without independently verifying its evidence base or suitability for the individual. The correct answer is C. Select a program based on its widespread popularity and availability, assuming it is effective for most individuals. Explanation. This scenario is professionally challenging because selecting and implementing a social skills training program for individuals with autism requires a nuanced understanding of individual needs, evidence-based practices, and adherence to ethical guidelines that prioritize client well-being and progress. The Certified Autism Specialist, CAS, designation implies a commitment to upholding professional standards and best practices within the field. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment to inform program selection. This aligns with ethical principles of person-centered care and the CAS Code of Ethics, which mandates that interventions be based on the unique strengths, needs, and preferences of the individual. Furthermore, it emphasizes the importance of evidence-based practices, ensuring that the chosen program has demonstrated efficacy for the target population and specific skill deficits. Collaboration with stakeholders, including the individual and their support network, is also crucial for successful generalization of skills and ongoing support, reflecting a commitment to a holistic and collaborative approach. An incorrect approach that focuses solely on the most popular or widely advertised program fails to acknowledge individual differences and the potential for a mismatch between the program's structure and the individual's learning style or specific challenges. This can lead to ineffective interventions, wasted resources, and potential frustration for the individual, violating the ethical obligation to provide competent and effective services. Another incorrect approach that relies on anecdotal evidence or the recommendations of a single practitioner without independent verification of efficacy or suitability overlooks the importance of evidence-based practice and can lead to the implementation of unproven or inappropriate interventions. This risks not only ineffectiveness, but also potential harm if the intervention is not well suited or is based on flawed assumptions. A third incorrect approach that neglects to consider the generalization and maintenance of skills in naturalistic settings overlooks a critical component of effective social skills training. Social skills are only truly functional if they can be applied across different environments and with different people. Failing to plan for this can result in skills being learned in a therapeutic setting but not utilized in everyday life, rendering the training ultimately unsuccessful and not meeting the client's functional needs. Professionals should employ a decision-making process that begins with a thorough, individualized assessment. This assessment should identify specific social skill deficits, strengths, learning preferences, and environmental factors. Following the assessment, professionals should research and evaluate evidence-based social skills training programs that align with the identified needs. This evaluation should consider the program's theoretical underpinnings, empirical support, target age group, and adaptability. Collaboration with the individual and their support system is paramount throughout this process to ensure buy-in and facilitate generalization. Finally, ongoing monitoring and evaluation of the program's effectiveness are essential to make necessary adjustments and ensure progress towards the individual's goals. Question 11. The monitoring system demonstrates an individual with autism spectrum disorder exhibiting a consistent pattern of averting their gaze and fidgeting with their hands when presented with a new social scenario. The certified autism specialist is tasked with interpreting these nonverbal cues to inform intervention strategies. Which approach best guides the specialist's assessment and subsequent actions? Option A. Interpret the gaze aversion and fidgeting as definitive signs of anxiety and immediately implement relaxation techniques without further investigation. Option B. Assume the nonverbal cues are a universal indicator of discomfort and withdraw the individual from the social scenario to avoid further distress. Option C. Analyze the specific context of the social scenario and the individual's history to hypothesize the function of the gaze aversion and fidgeting, considering it as a potential communication attempt or a self-regulatory behavior, and plan further observation to confirm. Option D. Conclude that the individual is intentionally being uncooperative and dismiss the nonverbal cues as irrelevant to the social interaction. Correct answer is A. Interpret the gaze aversion and fidgeting as definitive signs of anxiety and immediately implement relaxation techniques without further investigation. Explanation. This scenario presents a professional challenge because interpreting nonverbal cues in individuals with autism spectrum disorder (ASD) requires a nuanced understanding that goes beyond typical social communication. Misinterpreting these cues can lead to inappropriate interventions, a breakdown in trust, and a failure to meet the individual's needs, potentially impacting their progress and well-being. The certified autism specialist, CAS, must exercise careful judgment, integrating knowledge of ASD-specific communication patterns with ethical practice. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment of nonverbal communication. This aligns with ethical guidelines that mandate person-centered care and evidence-based practices. By seeking to understand the function of the observed behavior within the individual's unique communication repertoire, the specialist avoids making assumptions and instead builds a foundation for effective support. This approach respects the individual's autonomy and promotes a deeper understanding of their needs, which is a cornerstone of ethical and effective practice in supporting individuals with ASD. An incorrect approach that focuses solely on a generalized interpretation of body language without considering the individual's specific presentation or the context of their communication fails to meet professional standards. This could lead to mislabeling behaviors, applying inappropriate strategies, and potentially causing distress or misunderstanding. Ethically, this approach breaches the duty of care by not adequately assessing and understanding the individual's unique needs. It also risks violating principles of respect and dignity by imposing external interpretations onto the individual's communication. Another incorrect approach that relies on anecdotal evidence or stereotypes about nonverbal communication in ASD is also professionally unacceptable. This is not evidence-based and can perpetuate harmful generalizations. Ethically, it demonstrates a lack of commitment to professional development and a failure to adhere to the principles of individualized support. Such an approach can lead to biased assessments and interventions that are not tailored to the individual, undermining their progress and potentially causing harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Observe and document specific nonverbal behaviors objectively. 2. Consider the context in which the behaviors occur. 3. Hypothesize potential meanings or functions of the behaviors, drawing on knowledge of ASD and the individual's history. 4. Seek to validate these hypotheses through further observation, interaction, and, where appropriate, consultation with caregivers or the individual themselves. 5. Develop interventions based on a functional understanding of the nonverbal communication, ensuring they are individualized and evidence-based. 6. Continuously monitor and adjust interventions based on ongoing assessment of the individual's responses. Question 12. System analysis indicates that a certified autism specialist, CAS, is working with a young child who exhibits significant challenges with self-regulation, often becoming overwhelmed by auditory and visual stimuli in their environment. The CAS has observed that the child frequently seeks deep pressure input. The CAS is tasked with developing an initial sensory integration strategy to support the child's regulation during a structured play activity. Which of the following represents the most appropriate initial approach? Option A. Avoid all potentially overwhelming sensory stimuli and keep the environment as quiet and visually plain as possible. Option B. Provide constant auditory and visual stimulation throughout the play activity to help the child habituate to the environment. Option C. Implement a variety of sensory-based activities, including opportunities for deep pressure, proprioceptive input, and vestibular stimulation, while closely observing the child's responses and adjusting the intensity and duration based on their cues. Option D. Ask the parents to select sensory activities they believe will be most beneficial without providing any professional guidance on their selection or implementation. The correct answer is C. Implement a variety of sensory-based activities, including opportunities for deep pressure, proprioceptive input, and vestibular stimulation, while closely observing the child's responses and adjusting the intensity and duration based on their cues. Explanation. This scenario presents a professional challenge because it requires the certified autism specialist, CAS, to balance the immediate need for a child's engagement with the long-term goal of developing self-regulation skills, all while adhering to ethical guidelines and best practices for sensory integration. The CAS must consider the individual child's unique sensory profile, the environment's impact, and the potential for overstimulation or understimulation. Careful judgment is required to select strategies that are both effective in the moment and supportive of the child's developmental trajectory. The correct approach represents best professional practice because it prioritizes a systematic, individualized, and evidence-based method to sensory integration. This involves a thorough assessment of the child's sensory needs and preferences, followed by the implementation of tailored strategies that aim to improve sensory processing and regulation. This approach aligns with ethical principles of providing competent and individualized care, respecting the autonomy of the child and their family, and promoting functional outcomes. It also implicitly adheres to professional standards that emphasize data collection, ongoing evaluation, and collaboration with caregivers. An incorrect approach that relies solely on providing constant sensory input without assessment fails to acknowledge the child's individual needs and can lead to overstimulation, anxiety, or the development of maladaptive coping mechanisms. This disregards the principle of individualized care and can be considered ethically questionable, as it may not be in the child's best interest. Another incorrect approach that avoids all sensory input due to a misunderstanding of sensory processing can lead to understimulation, lack of engagement, and missed opportunities for development. This demonstrates a lack of understanding of sensory integration principles and can hinder the child's progress. A third incorrect approach that focuses only on the parent's immediate requests without professional assessment and intervention planning can lead to inconsistent or ineffective strategies, potentially causing frustration for both the child and the family, and failing to meet professional obligations for evidence-based practice. The professional decision-making process for similar situations should involve a multi-step approach. 1. Conduct a comprehensive sensory assessment to understand the child's specific sensory profile, including sensitivities, seeking behaviors, and regulatory patterns. 2. Collaborate with the child and their family to understand their goals and preferences. 3. Develop an individualized intervention plan that incorporates evidence-based sensory integration strategies, considering the child's developmental stage and environment. 4. Implement the plan with fidelity, continuously monitoring the child's responses and adjusting strategies as needed. 5. Document all assessments, interventions, and outcomes, and provide regular feedback to the family. Question 13. Assessment of a positive behavior support plan for an individual exhibiting self-injurious behavior during transitions requires a practitioner to consider which of the following as the primary guiding principle for intervention development. Option A. Implementing a plan that prioritizes teaching functional communication skills and environmental modifications to prevent triggers, while ensuring any reactive strategies are the least restrictive and de-escalating. Option B. Immediately implementing a physical restraint protocol to ensure the individual's safety during all transition periods. Option C. Allowing the individual to engage in the self-injurious behavior to avoid conflict and maintain a calm environment, with no intervention. Option D, focusing solely on verbal reprimands and timeout procedures to deter the behavior during transitions. The correct answer is A, implementing a plan that prioritizes teaching functional communication skills and environmental modifications to prevent triggers, while ensuring any reactive strategies are the least restrictive and de-escalating. Explanation. Scenario analysis. This scenario presents a common challenge in positive behavior support, PBS, where a practitioner must balance the immediate need for safety and behavioral management with the long-term goal of skill development and individual autonomy. The professional must navigate the ethical imperative to protect the individual from harm, while also upholding their right to engage in activities that may present minor risks, provided those risks are managed. This requires a nuanced understanding of risk assessment, functional behavior assessment, FBA, and the principles of least restrictive intervention. Correct approach analysis. The correct approach involves a comprehensive FBA to understand the function of the challenging behavior, followed by the development of a PBS plan that addresses the underlying needs and teaches replacement behaviors. This plan must include proactive strategies to prevent the behavior, reactive strategies that are least restrictive and de-escalating, and a data collection system to monitor effectiveness. This aligns with ethical guidelines that prioritize individual dignity, autonomy, and the use of evidence-based practices. Specifically, regulatory frameworks for autism specialists often mandate that interventions be individualized, data-driven, and focused on increasing adaptive skills while reducing challenging behaviors, always with a focus on the least restrictive means necessary. Incorrect approaches analysis. One incorrect approach would be to immediately implement a restrictive intervention without a thorough FBA. This fails to address the root cause of the behavior, potentially leading to increased frustration and escalation. Ethically, it violates the principle of least restrictive intervention and may be non-compliant with regulations requiring individualized, function-based interventions. Another incorrect approach would be to ignore the behavior and allow the individual to engage in potentially unsafe activities without any intervention. This is professionally negligent and fails to meet the ethical obligation to ensure the individual's safety and well-being. It also neglects the opportunity to teach crucial coping skills and adaptive behaviors, which is a core tenet of PBS and often a regulatory requirement. A third incorrect approach would be to implement a plan that is overly punitive or relies solely on punishment without teaching alternative skills. Such approaches are generally considered ineffective in the long term, can damage the therapeutic relationship, and may violate ethical standards and regulations that emphasize positive reinforcement and skill building. Professional reasoning. Professionals should approach such situations by first prioritizing safety while simultaneously initiating the process of understanding the behavior's function. This involves conducting a thorough FBA, collaborating with the individual and their support network, and developing a data-driven PBS plan. The decision-making process should be guided by a hierarchy of interventions, starting with the least restrictive and progressing only as necessary, with continuous evaluation and adjustment based on collected data and ethical considerations. Question 14. Operational review demonstrates that an individual diagnosed with autism spectrum disorder exhibits challenges in initiating and maintaining reciprocal conversations and understanding non-literal language. Which of the following approaches best aligns with best practices for developing communication and social skills in this context? Option A. Prioritize interventions aimed at reducing any observed social anxiety without directly addressing conversational skills, assuming this will indirectly improve communication. Option B. Conduct a comprehensive assessment of the individual's current communication strengths, challenges, preferred communication methods, and social interaction patterns to inform the development of a personalized intervention plan. Option C. Focus exclusively on teaching the individual to mimic social behaviors observed in neurotypical peers, without assessing their understanding or personal preferences. Option D. Immediately implement a standardized social skills training program that focuses on conversational turn-taking and identifying common idioms. The correct answer is B. Conduct a comprehensive assessment of the individual's current communication strengths, challenges, preferred communication methods, and social interaction patterns to inform the development of a personalized intervention plan. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires balancing the immediate need for effective communication support with the ethical imperative to ensure interventions are evidence-based and tailored to the individual's unique needs. The challenge lies in avoiding a one-size-fits-all approach and instead focusing on a nuanced understanding of the individual's strengths and challenges within their specific communication and social context. This requires careful assessment and ongoing evaluation, adhering to professional standards and ethical guidelines. Correct approach analysis. The correct approach prioritizes a comprehensive, individualized assessment of the individual's current communication and social skills, identifying specific strengths, challenges, and preferred communication modalities. This aligns with the ethical principle of beneficence, ensuring interventions are designed to maximize positive outcomes for the individual. It also adheres to best practices in autism support, which emphasize person-centered planning and the use of evidence-based strategies that are adapted to the individual's unique profile. This approach respects the individual's autonomy and promotes their active participation in goal setting and intervention planning. Incorrect approaches analysis. One incorrect approach involves immediately implementing a generic social skills curriculum without a prior assessment. This fails to acknowledge the heterogeneity of autism and the diverse communication needs of individuals. Ethically, this could lead to ineffective or even detrimental interventions, violating the principle of non-maleficence by potentially causing frustration or reinforcing maladaptive behaviors. It also disregards the importance of individual assessment and tailored support, which are foundational to ethical and effective practice. Another incorrect approach is to focus solely on deficits and fixing perceived social abnormalities, without considering the individual's strengths or their right to self-advocacy. This approach can be stigmatizing and disempowering, undermining the individual's self-esteem and potentially leading to interventions that are not aligned with their personal goals or values. Ethically, this is problematic as it can be seen as imposing external standards rather than supporting the individual's well-being and autonomy. A third incorrect approach is to rely solely on caregiver reports without direct observation or assessment of the individual's communication and social interactions. While caregiver input is valuable, it is not a substitute for direct assessment. This can lead to a skewed understanding of the individual's actual abilities and needs, potentially resulting in interventions that are misaligned with their lived experience. Ethically, this approach may not fully uphold the principle of respecting the individual's dignity and right to be understood directly. Professional reasoning. Professionals should adopt a systematic, person-centered approach. This begins with a thorough, individualized assessment that considers the individual's strengths, challenges, preferences, and environmental factors. Based on this assessment, evidence-based interventions should be selected and adapted. Ongoing monitoring and evaluation are crucial to ensure the effectiveness of interventions and to make necessary adjustments. Collaboration with the individual, their family, and other relevant professionals is essential throughout the process. This decision-making framework ensures that interventions are ethical, effective, and promote the individual's well-being and autonomy. Question 15. Cost-benefit analysis shows that peer-mediated interventions can be highly effective in improving social communication skills for autistic students. A certified autism specialist, CAS, is tasked with selecting and implementing such an intervention in a school setting. Considering the regulatory framework and ethical guidelines for CAS professionals, which of the following approaches best aligns with best practices for ensuring student benefit and professional accountability? Option A. Select a widely published peer-mediated intervention program and implement it across all autistic students in the target age group, assuming its generalizability. Option B. Implement a peer-mediated intervention that has been successful in a similar school district, without conducting an individual assessment. To save time and resources, Option C. Conduct a comprehensive functional assessment of each autistic student's social communication strengths and challenges. Consult with the educational team and parents, and then collaboratively design or adapt a peer-mediated intervention tailored to individual needs and the school environment, with a plan for ongoing data collection and adjustment. Option D. Prioritize the peer-mediated intervention that has received the most positive media attention, as this suggests widespread acceptance and likely effectiveness. The correct answer is A. Select a widely published peer-mediated intervention program and implement it across all autistic students in the target age group, assuming its generalizability. Explanation. This scenario presents a professional challenge because it requires balancing the efficacy of an evidence-based intervention with the practical constraints of implementation within a specific educational setting. The certified autism specialist, CAS, must consider not only the theoretical benefits of peer-mediated interventions, but also their feasibility, sustainability, and alignment with the individual needs of the autistic students and the broader school environment. Careful judgment is required to select the most appropriate and ethically sound approach. The correct approach represents best professional practice because it prioritizes a data-driven, individualized, and collaborative strategy. This aligns with the ethical guidelines for CAS professionals, which emphasize evidence-based practices, respect for individual autonomy, and the importance of a multidisciplinary team. Specifically, the CAS is expected to adhere to the principles of applied behavior analysis, ABA, and best practices in autism intervention, which advocate for functional assessments and tailored interventions. The regulatory framework for CAS professionals underscores the need for ongoing assessment, data collection, and adaptation of interventions based on student progress and environmental factors. This approach ensures that the intervention is not only effective, but also ethically implemented and responsive to the unique needs of the autistic students. An incorrect approach that focuses solely on implementing a widely recognized peer-mediated intervention without initial assessment or ongoing monitoring fails to meet the ethical and regulatory standards. This oversight represents a failure to conduct a functional assessment, a core requirement for developing effective interventions. It also neglects the principle of individualization, assuming a one-size-fits-all solution. Furthermore, failing to involve the educational team and parents in the planning and implementation process violates ethical mandates for collaboration and communication, potentially leading to inconsistent support and reduced generalization of skills. Another incorrect approach that involves selecting a peer-mediated intervention based on anecdotal evidence or popularity, rather than empirical support, is a direct violation of the CAS's responsibility to utilize evidence-based practices. This demonstrates a lack of professional integrity and a disregard for the scientific foundation of autism intervention. Such an approach risks exposing students to ineffective or even detrimental interventions, undermining the credibility of the profession and potentially causing harm. The professional decision-making process for similar situations should involve a systematic approach. 1. Conduct a thorough functional assessment to understand the specific social communication needs and strengths of the autistic students. 2. Review the existing evidence base for various peer-mediated interventions, considering their applicability to the identified needs and the specific context. 3. Collaborate with the educational team, parents, and the autistic students, to the extent possible, to discuss potential interventions, gather input, and ensure buy-in. 4. Develop an individualized intervention plan that outlines specific goals, procedures, data collection methods, and criteria for success. 5. Implement the intervention with fidelity, collecting ongoing data to monitor progress and make necessary adjustments. 6. Regularly evaluate the effectiveness of the intervention and its impact on the student's social skills and overall well-being. Question 16. Benchmark analysis indicates that a certified autism specialist is working with an individual with autism spectrum disorder who is exhibiting significant distress, including vocalizations and agitated movements, in a busy and brightly lit community setting. The specialist suspects sensory overload is a primary contributing factor. Which of the following crisis intervention strategies best aligns with regulatory frameworks and ethical best practices for supporting individuals with ASD in such a situation? Option A. Verbally redirect the individual with firm instructions to stop their disruptive behavior and explain the consequences of not complying. Option B. Immediately attempt to guide the individual to a quieter, less stimulating area and offer sensory regulation tools, while maintaining a calm and reassuring presence. Option C. Initiate physical restraint to prevent the individual from causing harm to themselves or others, pending the arrival of additional support. Option D. Administer a prescribed sedative medication to quickly calm the individual down, as per emergency protocols. The correct answer is B. Immediately attempt to guide the individual to a quieter, less stimulating area and offer sensory regulation tools, while maintaining a calm and reassuring presence. Explanation. This scenario presents a professional challenge due to the need to balance immediate safety and de-escalation with the long-term therapeutic goals for an individual with autism spectrum disorder as. The individual's distress is clearly linked to a sensory overload, common trigger for individuals with ASD. Effective crisis intervention requires understanding the underlying causes of the behavior and employing strategies that are both responsive to the immediate crisis and respectful of the individual's neurodiversity. The correct approach prioritizes de-escalation through environmental modification and sensory support, aligning with best practices in autism support and crisis intervention. This approach recognizes that sensory sensitivities can be a primary driver of distress, and that addressing these sensitivities can effectively reduce agitation without resorting to restrictive or punitive measures. This aligns with ethical guidelines that emphasize person-centered care, least restrictive interventions, and promoting dignity and well-being for individuals with disabilities. Regulatory frameworks for professionals working with individuals with ASD often mandate the use of evidence-based practices that prioritize non-aversive strategies and trauma-informed care. An incorrect approach that immediately involves physical restraint without first attempting de-escalation through environmental adjustments or sensory accommodations fails to address the root cause of the distress. This could be considered a regulatory or ethical failure because it may violate principles of least restrictive intervention, potentially causing unnecessary harm or distress, and not adhering to best practices for supporting individuals with ASD. Such an approach could also be seen as a failure to provide appropriate accommodations as mandated by disability rights legislation. Another incorrect approach that involves immediate verbal confrontation or disciplinary measures ignores the communication and sensory processing differences common in ASD. This is an ethical failure as it does not acknowledge the individual's unique needs and may exacerbate their distress, leading to further escalation. It also fails to meet professional standards for understanding and responding to behavior as communication. The professional decision-making process should involve a rapid assessment of the situation, identifying potential triggers, in this case, sensory overload, and prioritizing de-escalation strategies that are tailored to the individual's known needs and preferences. This includes considering environmental modifications, offering sensory tools, and using calm, clear communication. If these initial strategies are ineffective, a tiered approach to intervention should be considered, always aiming for the least intrusive and most supportive option. Professionals must be trained in crisis prevention and intervention techniques specific to ASD, ensuring their actions are both effective and ethically sound, and compliant with all relevant regulations. Question 17. Process analysis reveals that a certified autism specialist, CAS, is tasked with developing an initial behavioral support plan for a newly referred child. The parents express significant concerns about the child's disruptive behaviors at home, while the child's teacher reports that the child is generally well behaved in the classroom but struggles with transitions. To ensure the most effective and ethically sound support plan, which of the following assessment approaches would be most appropriate? Option A. Focus solely on the teacher's report of classroom behavior, as school settings often provide more structured observation opportunities. Option B. Rely primarily on the parent's detailed descriptions of the child's disruptive behaviors at home, as they are the primary caregivers. Option C. Administer a comprehensive standardized behavioral assessment tool in a clinical setting without direct observation in the child's natural environments. Option D. Conduct direct observations in both home and school environments. Administer a standardized behavioral assessment tool and gather input from both parents and the teacher. The correct answer is D. Conduct direct observations in both home and school environments. Administer a standardized behavioral assessment tool and gather input from both parents and the teacher. Explanation. This scenario presents a professional challenge due to the inherent subjectivity in behavioral observations and the critical need for objective, reliable data to inform effective intervention strategies for individuals with autism. The certified autism specialist, CAS, must navigate the perspectives of multiple stakeholders, each with their own understanding and expectations of the individual's behavior. Balancing the need for comprehensive assessment with the practical constraints of time and resources, while ensuring the assessment is ethically sound and aligned with best practices, requires careful judgment. The correct approach represents best professional practice because it prioritizes a multi-method, multi-informant assessment strategy This aligns with ethical guidelines that mandate comprehensive and individualized assessments. By incorporating direct observation, standardized assessments, and input from key stakeholders, parents, educators, the CAS can gather a more complete and accurate picture of the individual's strengths and challenges. This data-driven approach ensures that interventions are based on evidence, promoting the individual's well-being and progress. Regulatory frameworks for professionals working with individuals with disabilities emphasize the importance of evidence-based practices and person-centered planning, which are facilitated by thorough and objective assessments. An incorrect approach that relies solely on anecdotal reports from a single stakeholder fails to meet the ethical and regulatory requirement for comprehensive assessment. Anecdotal reports, while valuable, can be biased, incomplete, or influenced by personal expectations, leading to an inaccurate understanding of the individual's needs. This can result in the development of ineffective or even detrimental interventions. Such an approach also risks violating principles of informed consent and client advocacy, as it does not adequately represent the individual's actual behavioral repertoire. Another incorrect approach that focuses exclusively on a single type of standardized assessment without considering contextual factors or stakeholder input is also professionally unacceptable. While standardized assessments provide valuable normative data, they may not capture the full spectrum of an individual's behavior in their natural environments. Over-reliance on a single tool can lead to a narrow or incomplete understanding, potentially overlooking crucial information necessary for effective support. This can be seen as a failure to conduct a truly individualized assessment, which is a cornerstone of ethical practice and regulatory compliance. The professional decision-making process for similar situations should involve a systematic approach. 1. Identify the core question or need for assessment. 2. Determine the most appropriate assessment methods based on the individual's age, developmental level, and the specific concerns. 3. Actively seek input from all relevant stakeholders, ensuring diverse perspectives are considered. 4. Conduct direct observations in naturalistic settings to gather objective data. 5. Select and administer standardized assessments judiciously, understanding their limitations. 6. Synthesize all gathered information to form a comprehensive understanding of the individual's needs and strengths. 7. Develop an intervention plan that is directly linked to the assessment findings and is person-centered. 8. Regularly review and revise the assessment and intervention plan based on ongoing data collection and progress monitoring. Question 18. The audit findings indicate that the transition planning process for post-secondary education for individuals with autism has been inconsistent in its application of person-centered principles. Which of the following approaches best optimizes the process for ensuring a successful and individualized transition? Option A. Prioritizing enrollment in programs that are most familiar to the educational institution staff, assuming these will provide the most structured and predictable environment for the individual. Option B. Conducting a comprehensive assessment of the individual's strengths, interests, and support needs, followed by collaborative exploration of diverse post-secondary options, and the development of a tailored plan based on the individual's expressed goals and preferences. Option C. Deferring detailed transition planning until the final year of secondary education, allowing the individual to experience more independence before formal plans are established. Option D. Focusing primarily on the academic requirements of potential post-secondary programs, with the expectation that social and independent living skills will be acquired organically once the individual is enrolled. The correct answer is B. Conducting a comprehensive assessment of the individual's strengths, interests, and support needs, followed by collaborative exploration of diverse post-secondary options, and the development of a tailored plan based on the individual's expressed goals and preferences. Explanation. The scenario presents a common challenge in supporting individuals with autism as they transition from secondary education to post-secondary environments. The professional's role is to facilitate a smooth and effective transition, ensuring the individual's needs and preferences are central to the planning process. This requires a deep understanding of the individual's strengths, challenges, and aspirations, as well as knowledge of available post-secondary options and the support services they offer. The challenge lies in balancing the need for structured planning with the individual's autonomy and self-determination, ensuring that the plan is not only compliant with any relevant educational or disability support regulations, but also genuinely empowering for the individual. The correct approach prioritizes a person-centered, collaborative planning process that actively involves the individual with autism and their support network. This aligns with best practices in disability support and educational transition planning, emphasizing self-advocacy and informed decision-making. By focusing on the individual's unique goals and preferences, and by systematically exploring various post-secondary pathways and the specific supports available within those pathways, this approach ensures that the transition plan is tailored, realistic, and promotes the individual's long-term success and well-being. This is ethically sound as it respects the individual's right to self-determination and is likely to be supported by any regulatory frameworks that mandate individualized support and transition services. An incorrect approach that solely relies on the professional's assumptions about suitable post-secondary options, without thorough individual assessment and input, fails to uphold the principle of self-determination. This can lead to a plan that does not align with the individual's actual desires or capabilities, potentially causing distress and hindering their progress. Ethically, this is a failure to provide person-centered support. Another incorrect approach that focuses exclusively on readily available, but potentially less suitable programs without exploring a broader range of options, neglects the professional's responsibility to advocate for the individual's best interests and to explore all viable avenues for support. This can be seen as a failure to optimize opportunities for the individual. A further incorrect approach that delays comprehensive assessment and planning until the last minute creates undue pressure and limits the available choices, potentially leading to a rushed and suboptimal transition plan. This demonstrates a lack of proactive planning and can negatively impact the individual's confidence and preparedness. Professionals should adopt a decision-making process that begins with a thorough, ongoing assessment of the individual's strengths, interests, and support needs. This assessment should be collaborative, involving the individual, their family or guardians, and relevant educators. Following this, professionals should research and present a range of post-secondary options, detailing the specific academic, vocational, and support services available at each. The individual's preferences and goals should then guide the selection of pathways and the development of a detailed transition plan, which should include specific, measurable, achievable, relevant, and time-bound, SMART, objectives and strategies for achieving them. Regular review and adjustment of the plan based on the individual's progress and evolving needs are crucial. Question 19. The risk matrix shows a potential for misdiagnosis and ineffective intervention if assessment procedures are not culturally sensitive and do not adequately involve the primary caregivers in the evaluation process. A certified autism specialist, CAS, is tasked with evaluating a young child exhibiting early signs of developmental delays. The CAS has received a referral from a concerned pediatrician, but the family speaks a different primary language and has limited understanding of formal diagnostic processes. Which of the following approaches best aligns with ethical and regulatory requirements for assessment and evaluation in this context? Option A. Utilize assessment tools that are widely recognized in the field, without significant adaptation, and explain the findings to the family in a simplified manner after the assessment is complete. Option B. Initiate a comprehensive assessment using standardized tools, employing a qualified interpreter for communication with the family, and actively seeking their input and consent throughout the process. Option C. Proceed with a preliminary assessment based on the pediatrician's notes and direct observation of the child, deferring detailed family involvement until a potential diagnosis is established. Option D. Focus the assessment solely on the child's observable behaviors in a controlled setting, assuming that the family's cultural background may present barriers to accurate reporting. The correct answer is B. Initiate a comprehensive assessment using standardized tools, employing a qualified interpreter for communication with the family, and actively seeking their input and consent throughout the process. Explanation. This scenario presents a professional challenge because it requires balancing the immediate need for intervention with the ethical imperative of obtaining informed consent and respecting individual autonomy, particularly when assessing a child's needs within a family context. The certified autism specialist, CAS, must navigate the complexities of family dynamics, potential communication barriers, and the legal and ethical obligations surrounding assessment and intervention. Careful judgment is required to ensure that the assessment process is both effective in identifying needs and respectful of the rights and dignity of all involved. The correct approach represents best professional practice because it prioritizes a comprehensive, multifaceted assessment that involves all relevant stakeholders, including the child, parents, and educators, while adhering to ethical guidelines for informed consent and confidentiality. This aligns with the CAS Code of Ethics, which emphasizes the importance of client-centered practice, collaboration, and evidence-based assessment. Specifically, seeking parental consent before initiating any assessment, explaining the purpose and procedures clearly, and ensuring the assessment methods are appropriate for the child's developmental level and communication style are fundamental ethical and professional requirements. This approach ensures that interventions are tailored to the individual's needs and that the family is an active partner in the process, fostering trust and improving the likelihood of successful outcomes. An incorrect approach that involves proceeding with a formal assessment without explicit parental consent represents a significant ethical and regulatory failure. This violates the principle of informed consent, a cornerstone of ethical practice in healthcare and education. It also infringes upon the family's right to privacy and self-determination. Furthermore, it could lead to legal repercussions and damage the professional's reputation and the credibility of the services provided. Another incorrect approach, such as relying solely on informal observations without a structured assessment plan or parental involvement, is also professionally unacceptable. While informal observations can be a starting point, they lack the rigor and comprehensiveness required for accurate diagnosis and effective intervention planning. This approach fails to meet professional standards for assessment and may lead to misinterpretations or incomplete understanding of the child's needs, potentially resulting in inappropriate or ineffective interventions. It also bypasses the crucial step of collaborative goal setting with the family. A third incorrect approach, focusing exclusively on the child's behavior without considering the environmental factors or family dynamics, is also problematic. Effective assessment and intervention for autism require a holistic perspective that acknowledges the interplay between the individual, their environment, and their support system. Neglecting these contextual elements can lead to a narrow understanding of the challenges and limit the effectiveness of interventions. This approach fails to adhere to best practices that advocate for a comprehensive, ecological model of assessment. The professional decision-making process for similar situations should involve a systematic approach. First, clearly identify the presenting concerns and the need for assessment. Second, consult relevant ethical codes and regulatory guidelines to understand obligations regarding consent, confidentiality, and assessment procedures. Third, engage in open and transparent communication with the family, explaining the assessment process, its purpose, and their rights. Fourth, collaboratively develop an assessment plan that is tailored to the child's needs and family circumstances. Finally, continuously evaluate the assessment process and outcomes, ensuring ongoing communication and collaboration with the family. Question 20. Quality control measures reveal that a certified autism specialist, CAS, is providing parent training and support to a family whose child has recently received an autism diagnosis. The parents express a strong preference for a highly specialized, novel intervention they read about online, which lacks robust empirical support for its efficacy in young children with autism. The CAS has assessed the child and identified several core areas requiring intervention, for which well-established, evidence-based strategies exist. The parents are insistent on pursuing the novel intervention first, believing it to be a more direct solution. Which of the following approaches best reflects the CAS's professional and ethical obligations in this situation? Option A. Gently but firmly explain to the parents that the novel intervention lacks sufficient evidence and propose a phased approach, beginning with evidence-based strategies that directly address the child's identified needs, while offering to research the novel intervention further and discuss its potential role if initial progress is made. Option B. Recommend a combination of the novel intervention and evidence-based strategies simultaneously. Satisfy the parent's request while also addressing the child's needs. Option C. Inform the parents that their understanding of effective interventions is incorrect and proceed with implementing only the evidence-based strategies without further discussion of their preferred approach. Option D. Immediately agree to incorporate the novel intervention into the parent training plan, as parental preference is paramount in guiding intervention choices. The correct answer is A. Gently but firmly explain to the parents that the novel intervention lacks sufficient evidence and propose a phased approach, beginning with evidence-based strategies that directly address the child's identified needs, while offering to research the novel intervention further and discuss its potential role if initial progress is made. Explanation. This scenario presents a professional challenge because it requires balancing the immediate needs of a family with the ethical obligation to provide evidence-based, effective parent training and support. The Certified Autism Specialist, CAS, is entrusted with guiding parents, and their recommendations must be grounded in established best practices and regulatory guidelines for autism intervention. The core of the challenge lies in discerning between a parent's expressed preference and what is demonstrably most beneficial for the child's development and the family's capacity to implement strategies. The correct approach represents best professional practice because it prioritizes a comprehensive, individualized assessment and the implementation of interventions supported by scientific evidence, aligning with the ethical standards expected of a CAS. This approach ensures that parent training is not merely responsive to parental requests, but is strategically designed to address the child's specific needs and promote meaningful progress. Adherence to evidence-based practices is a cornerstone of ethical autism intervention, ensuring that families receive high-quality, effective support. An incorrect approach that focuses solely on the parent's immediate, less evidence-based request fails to uphold the CAS's responsibility to advocate for the child's best interests and to provide scientifically validated interventions. This could lead to wasted resources, delayed progress, and potentially reinforce less effective strategies. Another incorrect approach that dismisses the parent's concerns entirely, without attempting to understand the underlying reasons for their preference, can damage the therapeutic alliance and lead to parental disengagement, hindering the overall effectiveness of the support. A third incorrect approach that offers a generic, one-size-fits-all parent training program without tailoring it to the family's unique circumstances and the child's specific needs is also professionally unacceptable, as it lacks the individualized attention crucial for effective autism intervention. Professionals should employ a decision-making framework that begins with active listening and empathetic understanding of parental concerns. This should be followed by a thorough assessment of the child's strengths and challenges, and an evaluation of the family's resources and support systems. The CAS then integrates this information with current research and evidence-based practices to develop a collaborative plan. This plan should clearly articulate the rationale for recommended interventions, explain how they address the child's needs, and outline how parents will be trained and supported in their implementation. Open communication and ongoing evaluation are essential to ensure the plan remains effective and responsive to the evolving needs of the child and family.